We're warming up for this, the big reveal, the test, the strength test. So this would be the thing that I'm most like, we've already kind of followed hypertrophy, so we know that's happened, but do we really get stronger over that span when I haven't lifted that kind of weight in almost 9 weeks now? So we'll see. This is the big test. That's it. All right, well, felt it was the same. So the big reveal was 15 reps, same as I did 9 weeks ago. Even though I haven't lifted more than 145 pounds in that 9 weeks. Felt a little heavy at first, and I kind of stalled out at 8 or 9 and then was able to kind of gather. I'll probably drop my reps down and see what happens. Like with some hypertrophy, muscles should be able to get bigger quicker if we, do some neural drive activities. So grip strength went up a little bit. I tested it yesterday. Mild improvements on the two. I think left went up by 7 pounds, right kind of went up by 5. So there you go. All right, final statistics. Okay, so you guys can see the biceps, both sides, has basically stayed exactly the same as far as size. Chest went down slightly, and that's, I think, probably because I lost a little bit of weight, because you see I lost about 4.5 pounds during this process. The calf on the left particularly went up over 2.5 centimeters. On the right, it went up just about 0.5 centimeter, so that's pretty much a wash. The left thigh went up by almost like 2.5 centimeters. The right went up by about 1 centimeter. Waist went down a little bit. Weight went down a little bit. Hips stayed about the same. So you can see in these pictures, I trimmed out a little bit. You see my Dad-Bod here. Trimmed out a little bit more definition in the upper chest. In general, my strength stayed the same. So I didn't lose any strength in the upper body. I feel I got a lot more increased size in the left side of my lower extremity, which is where I'm injured at. So I got muscle mass that I hadn't had in the left leg. So I'm happy with that. So my overall thought process is that the BFR, again, I'm a chronic weightlifter, so I wasn't sure how much strength I would get. In all the studies, high intensity weight training and BFR had about similar results, or maybe sometimes a little better for the BFR. For me, similar results. I stayed about the same strength in my upper extremity and size. My lower extremity got stronger, and I attest that to the fact that, and bigger, that I can't really lift enough on my left leg to stimulate the muscle without injuring my left knee, which is very arthritic. So I think the BFR allowed me to gain a lot of muscle in a short amount of time and then not agitate my knee. Going on in the future, I'm actually going to use BFR a little bit more judiciously. So I'll use it for my warm-ups. And then I'll use it for my legs, for everything for legs, because that seems to be where it's been most beneficial for me. I also am using it based on the fact that we know that BFR cellularly and physiologically improves protein synthesis, which is what we need to build tissue up. It improves human growth hormone, insulin-like growth factors, which are also things that help with human tissue. There's also, I noticed it, and maybe it was made up, a little bit of a euphoria that occurred at the first few weeks that I'm attesting to maybe that increase in human growth hormone. I don't know. I'll have to look back in the research and see if that was something that other people reported. So again, I'm going to continue to use BFR for myself, but just less, not for everything. For my patients, definitely going to use it. I think it's something that you can try to use and experiment with, as long as you don't have any of those factors that we talked about before that say you can't use it, which would be like blood clots, hemophilia, severe heart disease, increased super high blood pressure, so risk of stroke. All right, if you guys have any further comments, problems, keep watching, following. We'll get you some more information. Thanks. Take care.